say there's someone who is thinking about starting therapy and wants to do therapy well, do therapy right, be a good therapeutic patient, not please the therapist, but get the most out of it. How do people do well in therapy?
What a beautiful question. And I think this is a question that everyone should learn or the answer to. So I have a couple of thoughts. The first is that remember that therapy is a partnership. And so we are so conditioned to do well, right? So like if you think about a child from a very young age, there's A's, B's, C's, D's, and F's. There's, in the United States, we have varsity and junior varsity, and we have, the A team and the B team. So we start segregating everybody up. We start measuring people up, and we assign you do right or you do wrong. So therapy isn't about that. It's a partnership between you and your therapist. So the first thing that I would say, concrete pieces of advice, one is that if you don't like working with your therapist, work with someone else. So there's a certain amount of idea that, okay, I must not be doing this right, or I need to try harder. What we know from something called common factors research, which is we did a bunch of research on therapy because there are all these different types, right? There's psychoanalysis and psychodynamic and cognitive behavioral therapy. And so people sat down and were like, which one's the best? And what we discovered is that all of it's about the same. There's some exceptions to that. But basically, it's all roughly the same. And the question is how could that be? Because psychoanalysis and talking about dreams is so different from mapping out your thoughts, your behaviors, and your emotions. And so what we discovered is that what really matters is fit. So you need to find the right person to be your therapist. So what I recommend to friends of mine who want to get therapy is I say, be prepared to make 3 appointments. And I even tell them at the get-go to make 3 appointments with 3 different people, 2 weeks apart. And then you can cancel if you really like one. But do the legwork. Don't try one and then then start the process of finding the second one. So I say make 3 appointments up front, 2 weeks apart, so you have plenty of time to cancel if you want. If you really try them all out, and then pick the one that you like the best.
What does that mean?
You will feel a difference. So there are some people where you're going to kind of walk out of the office and you're like, I don't really know if I enjoyed that, or if that was good or that was bad or whatever. But I think a lot of people, I've had so many therapy patients walk into my office and when the hour is up, they don't want to leave. Right. And especially for intake, sometimes I would schedule my intakes at the end of the day and we'd have a solid 2 hours of let's get into this. And then other people kind of come in, they kind of ask some questions. I do somewhat of an assessment, and it feels like we're kind of done at the hour mark. So I think people will feel the difference. So
okay,
just gravitate.
Choose well.
Yeah. Just and listen to yourself, right? So which one do you like the best? Second thing is that if something is not working for you in therapy, make that the therapist's responsibility. So this is where a lot of people will just switch therapists. But if you kind of say to some, if you're I'm not getting a whole lot out of this, or I feel like I'm stuck, share all of the problems that you see in therapy with your therapist. This is where everyone is so sad, but patients are so worried about disappointing therapists, right? And so the best thing that you can do for your therapy and for your therapist is to say, hey, this is working for me, or this is not working for me. And sometimes we'll even get to something really beautiful, which is that, okay, you think this therapy is not working for you. Let's examine the cognitive bias. You've been doing this for 6 months. Here's where you started. Here's where you are now. Would you call this progress? Why aren't you able to see the progress in your life? Holy shit. Because the moment that you realize—
tells you something about the patient as well.
Absolutely, right? So oftentimes solving the problems in therapy that you have with your therapist will be kind of the best way to accelerate the therapy. Half of the breakthroughs that I've had with patients, that's not 20%, let's say 30%, come from a period of difficulty in therapy. And
because it's a breeding ground for their patterns outside of therapy.
Absolutely, right? So this is where the concepts of transference and countertransference kind of come in.
I learned about this in my book last week.
And I would say talk to your therapist if things aren't going well. And then I would say the third thing is— yeah, I think actually that's number 1 and number 2. I think that's the
2 very good tips.
Yeah. So if you just think about the people in your life, right? So how easy is it for you to know what mistakes someone in your life is making? It's so much easier to see mistakes in someone else. And so the real value of working with another person like a therapist is that they can see your problems way clearer than you are, and they have a pile of training to really tease apart with the information that you give them really what's going on. So I'm not surprised at all that you have had an overwhelmingly positive experience in a short amount of time with therapy. I also think that other people's mileage may vary because generally speaking, the harder working you are, at introspection, the more mileage you'll get out of therapy. So I think the big irony is that a lot of men who are very independent and focus on journaling and meditation and want to improve their own lives, they will get so much benefit out of therapy because they've done so much internal work, and the two really combine. And that's part of the reason why I will combine a meditative practice with therapy, because it enhances the effect size of therapy when I help people train their minds. One thing that I've learned as a therapist is that, some people think in order to talk, and some people talk in order to think. Mm-hmm. And you don't have to make sense. The whole job of the therapist is to piece the pieces of the puzzle together for you. The last thing that I'll say, though, is we're talking about how important talking is, but it's now my belief, and there's some interesting data to support this, that this presumption that emotional healing has to come through words, I don't think is correct. So I think that part of what's happened, part of why therapy is not great for men. So there's research on things like instrumental support being useful for men. There's research on men not being able to dribble on the basketball court. And there's a couple of other things. So the other thing that, I'm a big fan of is like some amount of emotional healing through spirituality. And if you look at some of these spiritual traditions of emotional healing, like there are ritual, there are people like shamans or shamans and things like that. You have some of these like, we'll do in the Hindu culture, like pujas to alleviate curses and things like that. We have all this like religious ritual, which can be very emotionally healing. And there's research that stuff works too. The other really interesting thing is we're learning more and more about the physicality of emotion. So there's this one thing called EFT, called the emotional freedom technique, which I dismissed as pseudoscience about 10 years ago. Someone I knew sent me an email about it, and he was like, what do you think about this? It's called tapping, and basically people who have been traumatized, people will come and they'll tap on various parts of their body and it'll release the emotions, they'll be healed from trauma. I was like, this is BS. And I was like a research assistant at Harvard at the time, and I was like, this sounds absurd. And like, over the last 10 years, we've seen some studies that this appears to be somewhat effective. And there are now a couple of meta-analyses. Arguably, there's some methodological problems and things like that show that this is effective. So I think we're starting to learn that, and if you look at a lot of this like kind of men's somatic experience work that a lot of people are doing, that emotions are so physical. And it may not be that we need to use words. Like I'm all for proficiency of speech and alleviating alexithymia, but I've seen the power of just like, physical experiences, especially for men.
We've seen a great quitting of YouTube over the last 6 months. I think a lot of high-profile YouTubers really stepping back. You've been working at the forefront of this scene for a long time. What do you make of the great resignation of content creators that's happened kind of recently?
So I think the first thing is that I think that content creators have a much harder life than many people realize. I think you probably understand this. And it's not that we're not grateful, but I was talking to a family member of mine, and he's like, how do you like it? Right? Because I don't do a whole lot of clinical practice anymore. And so I told him something that I didn't quite appreciate, which is that I haven't had a day off in 4.5 years now. I've literally not had a day off. So I will go on vacations. But if you're a content creator, anytime you go on a vacation, the uploads need to continue. So you have to do whatever work needs, like I have to do that work ahead of time or after.
Yep.
So you never get a break. That's number one. And that's very different from medicine. Like, so in medicine, when I go on vacation, I sign out my pager. I have someone who covers for my patients, and they literally take care of everything when I'm not there. So the work gets done in your absence. But once you're a content creator, I think it's one of the few professions where you truly never get a vacation. So I think there are a lot of challenges with content creation. I think the second reason why people will quit is that, I don't know if this kind of makes sense, but so the human brain is not designed for the level of toxicity that most content creators experience. So our human brain doesn't think probabilistically. So if I have 10,000 comments on a YouTube video that are positive, and if I have one comment that's negative, my brain will literally pick out that comment. So if you live stream, you understand this, where there are comments that are going by literally faster than you can read. But if there is a negative comment, your brain will surface that to you.
Yeah.
So there's this weird thing where the way that our brains have evolved make it very challenging and emotionally like dangerous to be a content creator. So there's a high level of burnout. Oftentimes as content creators grow, they feel there's like this sense of like sand in the hourglass is running out, where like, someone else will come along. There's a gravy train. If I down, you're as good as dead. right? So it's growth, 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 and then you're going to be a has-been because the internet has a short attention span. And so people will kind of flagellate themselves and continue going. There's all kinds of other problems that arise, which is that as a content creator, at the very beginning, you get to experiment a fair amount. But once you get known for something, you get kind of locked into that. And then you can't really experiment anymore because the numbers go down and things like that. So there's a lot of like psychological. We worked with about 500 content creators, and we had there's a party organization called Stream Hatchet that was measuring the outcomes of our program, and they saw a 171% increase in like subscriber count without increasing the number of hours worked by a single hour. So one of the big ironies of content creation is as you become burnt out, it becomes harder to make good content. And as your content starts to go down, you emotionally become worse. And as you become emotionally worse, it becomes harder to make good content. Mm-hmm. So if you really look at what makes the best content, it's creators who are inspired. And then as the burnout sets in, the inspiration goes away, and then you're in the grind, and then you're repeating things over and over and over again. And it's amazing how far a little help goes. So with these particular people, like I don't have relationships, I think, with many of them. And even if I did, I wouldn't be able to publicly comment. But I think for a lot of them, it's just hard to keep it going. It's really hard. And you'll see this even in content creators who don't quit, which is they'll burn out and they'll like take a break for a month or 2 months or whatever. And then making a comeback is so hard.
Yeah.
Which means that people can't afford to take breaks. But I think that there are unseen mental health costs to the content creation industry, which even will work. I mean, we worked with Twitch where we supported 100 of their top content creators, and we saw really good outcomes from that. And I think people don't realize how mentally like straining it is.